Hi there, my name is Dr. Carly Axford and I'm the founder of the Spinal Flow Technique. And I wanted to speak today about the foundation gateway, but also one of the biggest causes of back pain, sciatica, pelvis pain, hip pain, pain into your bum, groin, and just around that region. So the foundation gateway is here. So I've got my little friend, the spine, and I just wanted to show you what it looks like. So this is a spine. And so if you have a look, this is actually the back, that's the front. And here we've got the foundation gateway. So the foundation gateway is where there's your sacrum through here, and we've got the ilium. So between the sacrum and the ilium, what we have is we have a joint in here, and that joint is called the sacroiliac joint. So this whole area, which you can be called, the pelvic girdle, pelvis, sacrum, ilium, where it meets at the front. It's also where the hip comes out of as well. This is what I'm referring to in the spinal flow technique as the foundation gateway. And the region of the foundation gateway is also at the dimples of your bum. So right now, while you're watching this video, if you want to put your hands at the back, and it's just above your bum, and is there dimples in your bum. So you want to come and find these dimples in your bum to know where it's actually called the PSIS. It's also where the sacroiliac joint is, but those dimples in your bum are right at the sacroiliac joint. And what I've found with lots of people that I've worked with is that one of the most common causes of back pain, sciatica, pain into that bum area is a blockage in the foundation gateway. And that blockage is specifically in the sacroiliac joint. So that sacroiliac joint here, around the sacroiliac joint, what you have is you've got lots of muscles that attach through there, and you've got the sciatic nerve that comes out of that area as well, that goes down your leg too. So if there's a blockage in that area, it can interfere with the nerve supply that's coming all the way from the spine down the leg. It can create the muscles to contract or to hold together, and it may even appear that it could make it also look like that one of your legs is appearing short. So I know with my clients, what we've done is we get them to lie on their tummy and we have a look and see if there's one leg that's appearing short, and then we bend the knees up to see if it's actually a structural short leg. But most often it's not. It's more that because the pelvis is holding together, the muscles are contracted, it's pulling that leg up to appear short. So it's not actually a short leg, but that is all showing us that possibly there's a blockage in the foundation gateway. You can also check your own posture to see if there could be a blockage in the foundation gateway, or you can get someone else to, and that's just checking the height of your ilium. So checking the height here, that's of these two. So it's basically just getting someone to put their hands right on the top of the iliac crest just to see if one side's higher, one side's lower. Or, when you see your spinal flow practitioner, that's something that they're trained in. They're trained into checking to see if there's a blockage in the foundation gateway. They're also trained to palpate, to actually feel if there's movement or it's stuck, because the foundation gateway is supposed to move, so have really good movement like all joints. But when there's a blockage, it means that it doesn't move as well. So a joint that moves does this, good movement. When a joint is stuck, it's like, it's stuck, it's not moving there. So often when there's stuckness, it indicates there's a spinal blockage in that area, which then can create an interference with the nervous system, with the messages from the brain through the spinal cord, but it also creates interference with that nerve that needs to come out to the muscles and all the organs and tissues as well. So when there is a blockage in the foundation gateway, it's really normal to feel back pain, sciatica, groin pain. It also could be emotionally that you're feeling like you're trying to move forward, one side moving forward, the other side, but you're feeling like you're holding back. The foundation gateway I call it the foundation gateway because it's our foundation, it's our support. So often if we're not feeling supported, we can get a blockage in that area. And also if we're stuck in a decision like, should I do this, should I do that? That can create also some more blockages in that area. So not only is there a physical cause of blockages in this area, there can be a deep emotional reason too. Some of the physical causes of blockages in the foundation are bending, twisting. So bending, twisting on that joint can create tears or tears in the microfibers between that joint. So if you have a look at the joint through here, you've got the sacrum, you've got the ilium. Between that, you've got all these little microfibers. When you're bending and twisting, you may be tearing just a small microfiber, but over time, as you tear more and more, there can be inflammation there. The body says, hey, enough, stop doing that. Inflammation, spinal blockage, and the body starts to compensate. And if you think about a spinal blockage like a strain or a sprain, like we all know what a sprained ankle feels like or looks like. It's like the ankle starts to inflame, you know that you can't put weight on it. That's what a spinal blockage in this area looks like. You know, there's inflammation, the body's saying, I can't put more weight on it. But just think about here, when there's a sprain or strain or spinal blockage, you've got like 68% of your body weight coming through this area. You've also got all the vibration from the ankle to the knee coming into this area as well. So it is a very hard area to be able to rest and repair when we've got body weight coming this way and vibration the other way. So I wanted to just do this video today to introduce you to the Foundation Gateway, to let you know that if you have been experiencing, pain or tension or sciatica or back pain, maybe you have a blockage in the Foundation Gateway. If you want to check if that's the case, then 100% see a spinal flow practitioner. Spinal flow practitioners are trained to locate the Foundation Gateway, to do a gateway assessment, to check the posture, and to palpate and to bring all those tests together to really determine if there's a blockage in there and what the cause is and how long it will take for them to help you heal. So definitely see one of our practitioners. They are pretty amazing. But also for you to know yourself, physical causes of blockages in the Foundation Gateway, bending, twisting, really putting that joint on an angle. And we've got, many emotional causes as well. So that's me just here to share some information for you on your path to either being an incredible spinal flow practitioner or helping your body heal yourself.